Role of Women Leadership in HIV Prevention by Dr. Quintanilla and Edith. She is a family physician with experience developing and implementing public health programs and coordinating health promotion initiatives. And also she performed a leading role as COVID-19 case manager team coordinator and supervisor in the COVID-19 emergency response with the Ontario Ministry of Health, promoting public health guidelines on COVID-19 prevention across the province. And she's currently working with the Ontario Disability Support Program claims analysis for vision care and hearing aids.
Producing an impact in the prevention of HIV. And I'm going to also present some organizational resources in Ontario that have so many tools that can be used in the course of achieving these objectives. So as we know, HIV remains a global public health issue. It has taken the lives of millions and millions of people around the world. The transmission is ongoing and in all countries globally. New positive cases in the diagnosis of every year. So much so that some research show that 5 out of 6 newly diagnosed HIV cases are teenage girls and women, young women under the age of 24 years old. In Ontario, the disparity is not so high, but we know that there is over 4,000 women living with HIV, and women represent between 20 to 25% of the new HIV diagnoses each year in the province. So, as we know, anyone can contract HIV, but social determinants of health significantly impact the lives of individuals and communities, making some women more likely to contract HIV. And the data of the research shows that 44% of these new cases were women, African women, Caribbean and Black women. 77% contracted HIV through heterosexual intercourse. And between 21 to 25% of these cases are associated with sharing needles during drug use. This is a very interesting. 8% of men reported getting the virus through the use of shared needles. And so I want to also to look at that 13% out there in the corner. This represents indigenous women that are also within the statistics of new HIV diagnosis every year. So the trends in this research that are related to drug use show that, as you know, Ontario has these drug use outreach services like safe injection sites and that sort of those sort of services that are available for everyone in Ontario. But the trends show that it's mostly men who are actually using these services, which is very interesting because in Canada we don't think that women don't have the choice of using it, but there are so many factors that are influencing that courage or that decision-making of saying, I'm going to use these services because it's safer than if I do it alone at home or if I share needles with somebody else. So it is important to remember that the social determinants are very important factors in how women approach healthcare services. Some of the demographics of women affected by these social determinants are women, obviously women living with HIV, women from African, Caribbean, Black descent, we mentioned earlier, indigenous women, and also women who have been incarcerated or are incarcerated currently. Women who use drugs or substances, women who have experienced or are currently experiencing violence, domestic violence. Newcomers to Canada, trans women, two-spirit people, and non-binary femme people. So all of these demographics within women have a high risk of contracting HIV. And these are all just social determinants. So what happens is that there are so many factors that influence the intersectionality of the social determinants of health and stigma. So a person, a woman living with HIV will face all of these factors that create barriers for them to access services in a timely manner. Some of these we can mention, we all know about this: racism and discrimination, limited access to housing, to social support networks, access to health, regular access to health services like vaccinations, for example, the immigration status, the gender inequality, and gender violence, misogyny, limited education and access to skills improvement, and just the cultural norms that we have seen have historically benefited the male counterparts. So when stigma comes into play, in addition to all of these factors, we can easily understand why it is so important that women become a pivotal part of the decision-making process in the improvement of programs and services for HIV prevention. And the reason why I mention all this is because in many, many countries, and that includes Canada, historically, women and the organizations that are led by women and that support women have been excluded from those meetings that talk about policy and talk about decision-making that directly affect them. And there is no way that we can tackle the USAID's goals, right, if we don't have action at all fronts. And action at all fronts includes the inclusivity of women. So within the framework of prevention, it is important to locate those sectors that women are present and have a better chance of accessing resources that translate into better health outcomes in the prevention of HIV. So in Ontario, there are these key sectors among women where there are multiple organizations that support strategies that fight violence against women, that support strategies against sexual assaults, organizations with faith-based and cultural support, Children Aid Society, access to housing, education, harm reduction programs, organizations that support anti-poverty and food security measures. So all of these sectors are those areas where women are definitely going to come and they're going to show up and they're going to look for resources. And those are some entryways where we can provide those resources for them to tackle HIV prevention. We know that HIV is preventable and treatable, but the challenge still remains that treatment needs to be given to the people who need it and ensuring that no one is left behind. So why do we talk about women, right? We are the first educators, traditionally. We're always the first educators. Oh, we educate our children. We educate children that are friends of our children. We talk to their parents, we talk to their teachers. We take that knowledge to church, to community centers, to other gatherings where we can promote this knowledge. And so I wanted to take an example of how powerful it is to provide resources to women in order to enhance their skills for leadership. So in 2021, on occasion of the 66th session of the Commission of the Status of Women in 2021, right? The United Nations Women and the United States AIDS Emergency Plan, they came together and collaborated to implement a program called Investing in Adolescent Girls and Young Women's Leadership and Voice in the HIV Response in Africa. And 15 countries participated in HIV prevention, treatment and care services, as well as essential services for responding to gender-based violence. And after the program, confidence for them to demand those services was increased. Another of the objectives was to engage decision makers for policy change and the inclusion of the diverse voices and perspective of adolescent girls and young women. And I want you to look at this picture here. This is a picture of the women who actually participated in the program. And there were so many other things that also came into place after the program had been completed. They reported that after they had received all this training and these resources, they were more confident in knowing how to approach. They had increased confidence with advocacy and communication tools, as well as a sense of sisterhood with one another. So obviously, it's very important to create that sense of community where I support you, you support me, we support each other, we support others. So there was a strong desire for further opportunities to continue collaborating in getting all these initiatives to come to fruition. So there was an increased capacity of all these girls to engage with the local communities and with healthcare providers to influence the decisions that were related to how the programs and services related to HIV were implemented. There was a confidence in approaching policymakers, which, as we know, is not very easy. And the inclusivity of women in the thought process of all these decisions. Just to think that we need women to come to the table and provide their views and their opinions on how the management of the epidemic should be taken into account. It's something in how they want to promote it. So it's a very simple, very simple example, but it's so impactful for whoever first see this video for the first time. It was impactful for me that I know a lot about HIV, but imagine those people who have a very limited knowledge. This would be very helpful. So it's a matter of having that confidence to step up and say, yes, I can do this, and I will be proving that women can impact positively the outcomes in the prevention of HIV. So I wanted to move on to just some final tips and takeaways of this presentation. One of the most important takeaways from today is the fostering of inclusivity. So the fostering of inclusivity does not limit, it's not limited only to women, but also to trans women, to women in the LGBTQ community, indigenous women. Many people who are being excluded because of many reasons, for many social determinants. Those determinants we talked about need to be included in these strategies. So one of the reasons why this could present a challenge is because there is not much knowledge what to do first. How should I start? Where to go? Who to talk to? So reaching out to the local organizations that already have steps in place to start then is a very good step for us to begin that impact. Utilizing the resources available to your benefit and to the benefit to those that you want to impact. And browsing the web, like Dr. Lawrence mentioned before, just the technology is at our fingertips. There's so much information that can be very useful in order for us to achieve that outcome. Sometimes volunteering or participating in events and other initiatives is a good first step. And talking to the women in your life. So sometimes just talking to the women in your life, talking to your daughters, talking to your sisters, to your friends, to your neighbors, is a way where we can promote those initiatives of HIV prevention. There are other resources in Ontario. I found that Women in HIV/AIDS Initiative, the Y.ca, has a few toolkits or starter toolkits where they tell you how to start mapping that strategy that you want to implement. And they offer many training sessions in which you can start putting into practice those strategies before you actually go into the real world and bring it out to the community. The Ontario HIV Treatment Network, as I mentioned earlier, and the Toronto HIV/AIDS Network, which facilitates planning of collaboration and engagement to improve access to programs. And I found this organization also very interesting, very helpful. The Ontario Organizational Development Program is an organization that they aim to help organizations within the community to achieve the goal of bringing those resources out. So they help establish what steps they need to take, how they should move in different environments. They provide trainings, mentorships. So for example, if I have this organization within in my community that we want to implement this new HIV prevention program, I can reach out to them and say, hey, we need some guidance, we need some consulting, and they will do that for you. So those are some very useful resources. I just want to say thank you very much for your attention, and yeah, I'll see you on the other side fighting for prevention.